We're still kind of in the presentation section of the hearing. So, Majority Leader, do you have anyone else wishing to be in the presentation section and then walk through the bill?
Yes, Madam Chair, with your indulgence, if the committee would like, we should have Mr. Wendell Potter. I think he is also going to provide just a sort of an explanation of why this type of legislation is important.
Okay, thank you. Please proceed.
Madam Chair and members of the committee, my name is Wendell Potter, Wendellpotter. A dozen years ago, President Obama told the joint session of Congress that a public option was necessary to keep insurance companies honest and hold them more accountable. Without the competition that a public option would provide, he said, it's easier for insurance companies to cherry pick the healthiest and drop the sickest, to overcharge small businesses and to jack up rates. He went on to say that, as one former insurance executive testified before Congress, insurance companies are not only encouraged to find reasons to drop the seriously ill, they're rewarded for it. All of this in the service of meeting what this former executive called Wall Street's relentless profit expectations. That former executive was me. Not long before that speech, I had left my career as head of communications at Cigna after a crisis of conscience. The powerful insurance industry was able to strip the public option out of the Affordable Care Act to protect profits. In the years since that bill was enacted, insurance companies have only become bigger and more emboldened in their efforts to keep people from getting the care that they need. Insurers have also become some of America's most profitable companies. In fact, most of them have posted record profits during the pandemic. Those record profits are the result of barriers that insurance companies have erected that make it more and more impossible for people with insurance to get the care that they need. Hundreds of thousands of your constituents still cannot afford health insurance because of ever increasing premiums. Many others who do have insurance cannot even pick up their prescriptions because insurance companies now make them pay, in many cases, thousands of dollars out of their own pockets before their coverage kicks in. It isn't just ordinary folks who are being fleeced by insurance companies. So are employers, most of whom were hard hit during the pandemic. A recent survey by the Kaiser Family Foundation found that the CEOs of even America's biggest employers now want the government to play a bigger role in bringing down the cost of healthcare. In my old job, I helped carry out numerous propaganda campaigns to scare people about health care reform proposals at both federal and state levels. One of the ways we succeeded was going into states and recruiting hospital executives and provider groups to serve as our messengers. It was dishonest work, which I will always regret. If I hadn't quit, I might still be writing misleading talking points for the industry's front groups, like the ones they call Nevada's healthcare future. Assembly members, how you vote on this bill will result in either more Nevadans being able to get the care that could save their lives, or further enriching the people who are bankrolling the campaign against the bill before you. You have the power to hold insurance companies more accountable and bring down the cost of healthcare and health insurance. Don't let the industry's greed keep you from doing what is right for your constituents. Thank you.